Now, in the last 24 hours, New South Wales recorded 65 cases of community transmission. Now, obviously, that's a welcome drop on yesterday's numbers, but it comes with a warning in that 28 of those cases were infectious in the community whilst they were obviously out and about. So that is the critical number that we need to watch in the days ahead. We need to get that 28 number as close to zero as possible. So based on the fact that we had 28 people infectious in the community in the last 24 hours, I am predicting we will have higher case numbers tomorrow. Now, I want to send the following strong message to the community. Whilst the case numbers are bouncing around, we are seeing a stabilisation. They are not growing exponentially. That tells us that the settings we have in place are having an impact. So my strongest message to everybody is keep doing what you are doing. Keep sticking to the rules because we are seeing the impact of that. But the next challenge for us is to see a drop in the numbers of people infectious in the community. We are seeing a level of stabilisation, but we need to see those numbers drop. So please make sure you keep sticking to the rules. Make sure you stay home and only leave the house if you absolutely have to. Regrettably, a number of people who were infectious in the community were because they went to pharmacists while they had symptoms to get medical attention. They went to GP clinics, they went to GPs. Please know that if you have symptoms, the only place you should go is to get tested and come home and isolate. If you're worried about your health condition and have symptoms, please call a health clinic, your GP or somebody on the phone. Do not present yourself to a pharmacist or a medical centre or a GP clinic if you have symptoms, because unfortunately a number of cases that were picked up were people who had the symptoms and went to get medical attention. It's so important that if you have symptoms, the only place you should be going, and again with caution and care, is to get tested and stay home and isolated. And make sure that is the case, because we don't want to see those transmissions in medical centres or medical facilities, because unfortunately a number of those cases were picked up having visited those sites. So my words of encouragement to the community are keep doing what you're doing. We're seeing the mobility data show us continually that people are moving around less, and there's a lag in that data. The data we get is about 4 or 5 days old, but what we do know is that 4 or 5 days ago there was a significant drop in mobility, and that's exactly what we want to see. What that means is do not move around unless you have to. Make sure you stay home unless you absolutely have to, and please keep sticking to the rules. We know from where the numbers are now that the settings in place are having an impact. I know that we'll get through this. We won't hesitate to make difficult decisions if we need to. But I want to say this to the community of New South Wales. We've been through these difficult times before, admittedly, not with the Delta variant, which is different to what we've experienced before. But we've been through challenges before and we've come through, and I know we can do that again. So please know that our collective effort is having an impact, but we need to make sure that we do not let our guard down at all, quite the contrary. Keep limiting your mobility, keep making sure you stick to the rules, because it's having effect. And the next stage we want to see is that infectious number of people in the community go down to close to zero, which will get us out of the lockdown. 28 was too high yesterday. Even though the case numbers are lower, that 28 was too high, and I suspect tomorrow the case numbers will bounce back up. So we are in a stage now of stabilising, but we want to do better than that to get out of the lockdown. We need to do better than that to get out of the lockdown. We need to see a decline. So keep doing what you're doing. Make sure you stick to the rules. If you have symptoms and you're in doubt, call somebody before you leave the house. And please make sure that all of us work together, get the message out to make sure our friends and family and loved ones are protected. Thank you.